All right, so every parent knows we don't hold infants by their head once they're out of the womb. What a lot of parents don't realize, though, is that very first contact by a human hand, or maybe a forceps or a suction device, was that same type of force, that distraction force on this little one's neck. And it could have been you too. You could still be carrying this type of a stress and this type of trauma with you throughout your life if it hasn't been addressed. So in this episode, in this video of the subluxation cycle, I'm going to tie in how that type of physical stress onto a newborn during the birth process can lead to what we call subluxation and nerve interference, and then take away from that little one's quality of life and possibly be causing some of these symptoms and conditions that nobody else seems to have an answer for. So let's get started. Before we get started though, if you haven't seen the original video of the subluxation cycle, please make sure you do check that out. That's going to give a more in-depth explanation of what this is. And also, if you like this video, please like it, follow us on social media. We would love to get you plugged in and teach you more or explain more about how this affects you and your loved ones. So to start off with, this is a physical stress. It's not so much an emotional or chemical stress that we're talking about today. It's a physical stress. And when that little one has that twisting or distraction force on their upper cervical neck, that can disrupt, can inflame, can do a lot of damage to the spinal cord. Now, the spinal cord is what's responsible for sending messages from the brain to the rest of the body and then receiving information from the rest of the body back to the brain. So bad information, bad decision making, bad output, we get a very disrupted state of health. And that's what we're talking about here when the nervous system gets overwhelmed to the point where nerve interference is created. We result, or that little one is in a diseased or imbalanced function state. Now, these little ones, they can't talk to us, they can't tell us what's going on, so oftentimes we see that manifest as irritable bowel syndrome or colic or possibly chronic infections, leading all the way to the ear infections that are so prevalent in some kids but not prevalent in others. They all have, in general, the same more horizontal eustachian tubes and more likelihood of an infection because of that. But some kids get them and some kids don't. So there's got to be a better explanation for why that is. So more on that later. But essentially what happens here with that physical stress, if it was enough to overwhelm your little one's nervous system, they're going to be carrying nerve interference right throughout their whole life. How that manifests, it can vary, and it can basically be any sort of dysfunction. But if that little one is set off with a decreased stress response, what we're going to talk about today is that's going to predispose them to have a poor reaction to the other things coming at them later in life. Because there's going to be more physical stress, more chemical stress, and more emotional stress the longer as life continues. So for example, some kids have allergies, peanuts, soy, gluten, dairy, things like that, and some kids don't. What we find in our practice is a lot of times the ones with the most severe allergies, there is a common thread of a significant physical trauma during the birth process. So that little one was set off with nerve interference to their immune system and possibly the digestive system that made it more likely for them to have a poor response to the peanuts, the gluten, the soy, that some kids don't have that kind of response to, but this little one did. Or for example, sometimes the vaccine reactions or other toxins, pesticides, things like that, medication reactions, all of that can come from, and often does start from, a significant amount of birth trauma. So what we need to do is we need to check our little ones and make sure that there is not that disconnect right out of the gate, right starting off their life. Not to mention how that can manifest with the scoliosis and the misalignment in their spine as they start to grow, as they start to pick their head up. There's a lot going on here, and we all want, as parents, the best for our little ones. So if this interests you and if you'd like to learn more about it, please reach out, get plugged in, follow us on social media, reach out today if you can, and also for yourself. We don't know, we carry this with us, and if that interference, your brain isn't able to overcome and heal from that, that is a trauma you carry with you and have possibly carried with you your whole life, leading to a decreased stress response to this day, decreased health, and ultimately quality of life. We want the best for you. We want the best for our kids. Please reach out, and if we can do anything to help you, we'd love to serve you.